Okay. So good morning, everyone, and good evening for those of you on the other side of the world. It's a pleasure to invite you for a focus session on young women breast cancer on this World Cancer Day 2025. 4th of February, as you know, every year is uh, commemorated to cancer survivors, people who are fighting for, to stop deaths due to breast cancer, and so many of the researchers who are working on treating cancer, and also mainly to spread awareness about cancer so that we can try to take preventative steps, change our lifestyle, as well as be ready to fight if at all it hits us. As you're aware, Niramai is a startup, I guess a company now 8 years old, with a mission to detect early stage breast cancer globally and hopefully stop deaths due to breast cancer. On this particular day, we are very, very glad to have two wonderful speakers uh, with the focus uh, of the day to be on young women breast cancer or breast cancer seen in young women. The two wonderful speakers are Dr. Rakesh Kumar, sir, who is dialing in from Denver, who is the CEO, founder, and managing director, chairman of Young Women Breast Cancer Foundation, which is a global nonprofit trying to address this issue with awareness and several programs which he's going to talk about. We also have Dr. Samrakshini, who is an excellent inspiration to so many of us, who is a breast cancer survivor. She got detected with her breast cancer, unfortunately, in her young medical school days, and how she fought this. And then now she's a famous gynecologist in motherhood in Bangalore, HRBL layout. So would love to hear her story as well. There's a third segment where Dr. Shiva, who is Forbes 30 under 30, is going to talk about how technology is being used to detect cancer, breast cancer, particularly in young women using Thermalytix, and present recent paper that we published in a journal focused on young women breast cancer. In fact, that journal is founded by Dr. Rakesh sir again. So we have a bunch of very, very interesting talks and learnings to do in the rest of the hour. Just a bit of introduction to who we are. I am Geeta, founder CEO of Niramai Health Analytics, which is a deep tech digital health startup based out of Bangalore. We do have offices in Abu Dhabi and UK as well, and also in EMTZ, Andhra Pradesh. We are considered as pioneers by World Economic Forum as technology pioneers for inventing this new technique called Thermalytix, which is a novel AI-based test for converting skin temperature maps to a cancer health report. We are focused on breast cancer at this time, and this novel technology has resulted in 36 granted patents, where we just measure the temperature variations on the chest using a thermal sensor and convert the temperature map with 4 lakh temperature points into a cancer health report using artificial intelligence-based techniques. These techniques are not only approved in India, it's also approved with the CE mark in Europe and several other countries, and also cleared by US FDA as an adjunct at this time. So far, we have helped 250,000 women, that is 2.5 lakh women, detect their cancer or make sure that they are clear as well. And thankfully, with so many of the awards that we've been receiving, recognition receiving from around the world, we are right now available in 22 countries beyond India. So with that introduction to Niramai Health Analytics, we regularly conduct awareness talks, webinars, where people can get to hear the top experts in this field. And today, we are very, very glad to have Dr. Rakesh Kumarji, founder and CEO, BCYW Foundation, Breast Cancer Young Women Foundation, United States. He is going to educate us about this problem and what are the efforts that the foundation itself is taking to fight this problem or create awareness about this problem. Just to set stage, we all know, or many of us know, that more than 27% of all cancer deaths in the world happens to be in women under 45 years of age. And wonderful techniques like mammography, etc., are only recommended above 45 years. So how do we detect cancer if it comes at a young age? In US alone, 2,500 women died of breast cancer last year in 2022, just under 45. So this is a huge issue we need to address. And here we are focusing on this problem. India specifically has the mean age for breast cancer detection to be 1 decade younger than the world average. So we have many, many more, unfortunately, many, many more cancers, breast cancer in young women that is seen in India. Many of them are triple negative breast cancer as well. So let's hear more from the experts about this particular problem and how we can all get ready to fight it for us and for others as well. Thank you once again, Dr. Rakesh ji, for agreeing to speak on this topic and agreeing at short notice to dial in at late night from the United States as well. Just there's so much to talk about, Dr. Rakesh sir. As I mentioned, he is the founder and chief executive officer for Breast Cancer in Young Women Foundation, headquartered in Denver, now spreading its wings all over the world. He's also editor-in-chief of the journal, the first journal focusing on this topic, which was launched last year. And he is endowed chair professor at Cancer Research Institute, Himalayan, Medical School in India, in Dehradun. He's also adjunct professor in Rutgers, New Jersey School of Medicine, Newark. He's a visiting professor of human and molecular genetics at Richmond, USA. His core scientific focus has been in his long career, right, being on breast cancer. And you can't, we have so much to learn from him, right, where he's been focusing his whole career on breast cancer, particularly looking at tumor biology and conducting a lot of global breast cancer initiatives. He has had several key positions across India and other countries. He was also Government of India, DBT, Department of Biotechnology, first national chair in cancer research and distinguished professor as well. And he has tenured professorships in multiple universities, faculty positions in multiple universities, in such universities such as Memorial Sloan Kettering, MD Anderson Cancer Center, Penn State University, and so on. He got his basic PhD in biochemistry from AIMS, New Delhi, and postdoctoral training in molecular biology in Memorial Sloan Kettering, New York. He's also on multiple editorial boards, and he has given multiple key talks in different conferences and symposiums. 325 plus peer-reviewed publications show his research standing. And we are super excited to have him deliver a talk on young women breast cancer. Sir, the stage is yours. You can please share, sir.
Thank you, Dr. Geeta. Let me
start.
We
can see.
Okay. Good morning to all of you who are joining this webinar. And let me start by thanking Dr. Geeta and Naramai for putting together this wonderful program and inviting me to share some of my thoughts. Well, there was no need, Dr. Geeta, to give such a nice introduction. I'm just one of you trying to do my best. But I would like to start by telling the brief history why we started this foundation at the first place. Being a breast cancer scientist close to 4 decades, we have lots of colleagues who have been seeing breast cancer patients as a part of their career. And many times, these colleagues have been faced with young women and they have been asking, why me? Many cases, there was no traces of predisposed genes or there was no family history. So they really have no answer why me. Me and my mentors were aware of this issue almost 25 years back. And over the course of last 2.5 to 3 decades, we still have very little understanding of the biological basis of young breast cancer, why younger women are getting breast cancer, what is really causing it. Clearly, we all needed a different approach. So we decided to create a foundation which is different from others and to try to create an NGO which could have its impact beyond USA. With that in mind, why I'm not able to move? Yeah, okay. With that in mind, so what's unique about this
Sir,
foundation?
can
Yeah.
you use the slideshow mode? It will be good, sir, basically.
Oh, slideshow mode will be on the timer then. Then I have to, because it will just go with the time.
Okay, no problems. No
Okay.
problem, sir. You can continue.
Because there are many hundreds or thousands of breast cancer NGOs around the world. So why we need one more foundation? Well, we are very proud to say this is the first such foundation focused only on the young woman breast cancer. This is also unique in the sense this is a foundation led by doctors, scientists, and many of my colleagues have been pioneering in cancer medicine. It's well supported by the caring survivors and their families. We have on our foundations mothers who lost their daughters. We have sons who lost their mothers, and we have husbands who lost their wives. Uh, the pink ribbon has done miracles over the last 4 decades. But the pink ribbon does not capture the complete essence of younger women breast cancer because they face unique challenges as compared to the older women. So we decided to create a new pink purple ribbon. Our core awareness material is in 13 different international languages, and we have brave survival stories in 6 different bilingual languages. At the moment, we have our team is around 75 plus members, and half of them are physicians or surgeons, or they have been seeing breast cancer patients every day of their career. We have partners in 27 countries, and we are focused on breast cancer all around the year. We also decided to create new global programs which have not been there. And there is a story behind this logo which we created. What's really so unique about it, I'm not going to go into detail, but there is a reference at the bottom. So let me come back to the breast cancer. Well, as Dr. Geeta mentioned, that breast cancer is one of the number one leading cancer in the women's, and about 27% of the deaths are accounted because of the breast cancer in the case of females. When we come to, if we compare the global versus India, maybe around 13.5% of the new breast cancer cases in India are falling within 40 years old, as compared to the global rate, which is around 10.7% of the new cases. So by and large, 1/4 of the new cases, if we really combined up to 40 and 44, could be in breast cancer in certain countries, and this number varies. Also, if we look at the age distribution for young breast cancer in India in 2022, you could see that almost half of those cases are in the range of 20 to 34-year-old. So that means this is not a rare breast cancer compared to many others. This is quite popular, and it's really affecting the younger women. Now, when it comes to the number, this has been a recent phenomenon. If you look at the data back in 1984 and 2012, there were very few number of cases in India. Around 48 cases were reported, and in US only about 1,250 cases were reported. And over the years, these numbers have really gone further. If we normalize this number in terms of per 100 population, the rate of young breast cancer in India is still quite low compared to many other countries or the global rate. Global rate is around 8.1, while in India it's about 4.6. So we are quite low compared to the world, but the way the trend is going, this is not going to be the case in next 5 to 10 years. Well, the new data now suggests that breast cancer in young women will continue to grow until 2050. And this growth is different for different countries. For India, it will continue to grow up to 2040, while for US, it will continue to grow up to 2040 to 2050. And for most of the country, it will continue to grow up to 2040. But the overall trend will continue to grow up to 2050. This increase in the number of young women breast cancer cases are not because of the population alone, because if you look at the number of the percentage of younger women between the age group of 15 to 39 or 20 to 39, from 2012 to 2050, the number has already started declining. There is a population issue here, fertility issue here. So with time, the population will start coming down and the numbers will also come down. So although the population has already started dropping down, but the number of breast cancer cases in young women will continue to grow. This also dissociate. This increase is not largely because there is a larger younger population. Rather, there is a biological basis of it. We still have to understand what are the triggers which are responsive for initiating the process at the first place. So if we look at the number of cases versus the age, with time, this curve is likely to shift from right to the left. And in majority of the cases, there is no genetic history. There is no family history. About 8 to 12% or 8 to 15% of the breast cancer are due to genetic reasons. But in majority of the cases, around 85% have no genetic basis. So the genetics alone cannot explain why we are getting breast cancer, why it is increasing. There are multiple mechanisms which are responsive for it, and we will go very briefly into it. But let's talk about the bigger picture. Bigger picture is we all have learned from the textbook that the pregnancy provide a very good protections. And with the modernization of the society, the age of first pregnancy or the age of marriage is shifting to the right. Well, this is something which we just cannot address because this issue falls into very different sensitive issue about the woman's right and individual freedom. But again, this is one of the contribution. And with every 5 years of delay in the first pregnancy, there is a risk of around 5%. There are a number of risk factors which have been coming time to time, and I have just listed only a few of them. So in nutshell, it's a balance between the protective factors and risk factors. So also, there is a data coming out last 5 to 10 years now, very good data, where scientists have discovered some of the changes which are cancer specific could be detected in healthy breast as early as 14 to 15-year-old. So this really suggests that although it takes a long time, it takes about 8 to 10 years for breast cancer to be clinically detectable. So if a young woman at the age of 25 or 28 or 22 is having a breast cancer, it was not started yesterday. It must be going on at least last 6 to 8 years. And now there is a data to support how much time it takes to grow the cancer, different kind of cancer. People have done the genetic tree and the aging relationship, and it takes about 10 years. So it is the window from puberty to adulthood which really play a very critical role. And there are changes which are introduced at that point, And over time, those cells could be at risk of developing cancer. So the question is, why younger women are getting breast cancer? What is there that we need to fully understand? Well, breast cancer is not driven by a single gene. It's a polygenic in nature. And it involves multiple factors. There are internal factors, there are external signals, and there is an interplay between internal and external signal over a period of time. Each day, when we open up the newspaper, there are new risk factors. So there is a growing number of risk factors which we hear every single day. And I would come back to that and that in a minute, because many of these risk factors are not validated, and they create a panic in the society at times. So we will revisit that in a minute. There are many unresolved questions in the field which we need to understand. Rather, I would like to focus today on 5 or 6 risk factors which have been time tested over the years. So those are the risk factors I like to focus. But we are far from away to a stage where there will be a test, just like the many other human chronic disease, blood pressure or hypertensions, where a doctor can predict to to some extent when exactly you are going to get a disease. Right now, we are not in a stage where we will be able to predict who amongst the healthy women will be able to get breast cancer and when. We are far from there, and this is the direction the Breast Cancer Foundation want to make at least one contribution. So there are a number of biological factors. There are a number of causative factors which we hear every day. But those biological factors cannot be explained by the genetics alone. The rise in populations and the human studies are equally important. And many of the questions which we hear, which we investigate in the laboratory, are coming from the population studies. They do play a major role. But also, risk factor is also a focused area of media attention. But remember, not all risk factors have the same scientific weight. I just try to plot a graph here to show how many publications are there in PubMed with the term risk factor and breast cancer or in young women. There are in thousands. And each year we hear 900 chemicals, thousands of molecules, forever chemicals. So the fact is, many of these things are indeed not slide. I think I have to go to slide mode. Yeah, you are right, because there is something hiding here. Yeah.
Yes, sir. Next. Yeah.
Yeah, there was something hiding here. I'm sorry. Yeah. So, there are many chemicals which we hear every day. So again, many of the risk factor which we hear, they are not subjected to the scientific rigor which we use for the clinical trials. And many times, there is not much control data, and they have been not repeated over time. And in the end, all of these risk factors really create a confusion or a misconception in the society or a fear. Now, there is also issue of there is no end to risk factor, because many of these risk factors which we hear every day, they are by implication. They have not been tested over time. There's no data to support it over time, but they do provide us some degree of caution. But again, we all have to live our life in the end. So it is important, when you hear about a risk factor, do some homework before you start getting panicky about it. Well, I focus on few long-standing population studies and talk about two or three such risk factors, and but there are very few studies which are causative in nature. I think we all have we have heard a lot about that pregnancy protect against breast cancer, which is true, and every 5 year of delay will put you risk at least 5% per 5 years. So there's a study which came out 2 years back from Oxford, and this study really used normal tissues from healthy breast, which have never been exposed to any contraceptions. These women never took any contraceptions from different age group. What was very clear in this study that as your normal health is in a mammary gland cells grow, they accumulate mutations, and they accumulate around 15 mutations per epithelium cells and about 12 mutations in stroma per year. And with time, this number of mutations grow. And when at a later stage, these cells have already accumulated a lot of mutations, when they're exposed to the pregnancy hormones, then these cells are the one which will have a growth advantage compared to others. So that will really put you at risk. So again, there is a biological basis why early pregnancy protect and not the late pregnancy. We have also heard about one of the risk factors which have been well debated over the last 4 decades is the birth control pills. And this really comes back again and again. This is again a personal issue of women's choice, because everyone has to decide the pro and cons, gains versus loss. Yeah, there is a risk associated with it. And in this case, a very recent studies used 27,000 case controlled studies where they made it very clear that all kind of oral contraceptions, no matter what kind of hormonal formulation they are using, will increase the risk by 20 to 30% as compared to the non-users. And this risk is further amplified in the younger women from 8 cases per thousand to 265 cases per thousand. So again, this is not new. This is a paper which came out last year, 2024, but this has been predicted almost in 1995 into another studies where they used all the patients less than 35-year-old, and they also predicted use of contraception in younger women will create additional risk factor as opposed to the older. And this additional risk factor is many fold, 5 to 7-fold rather. We also understand there is a risk, there is a tendency now that younger and younger women are getting early menarche. And the question is why they are getting early menarche. That is, we don't know yet. But there's a changing pattern of age at which there is a, they started menarching. And a very recent studies involving 71,000 women also indicated that with age, this is indeed growing to the younger and younger. And very early, less than 9-year-old, less than 11-year-old is the pattern which is moving now. What is important here? Why these women are getting they are getting early menopause? What is really triggering it? And this is open questions. And recent studies from NIH now suggest that there are molecules which are in the perfumes and many other molecules. They go to the brain and they will activate your hypothalamus, which will now regulate your reproductive axis. So, also, we have, I would like to talk one more risk factor before I switch to the programs, is there are a lot of personal care products which women use, and many of these products are endocrine disruptors. So this is the first study which is causative in nature. There have been a lot of talk about it, whether use of such molecules in the perfumes or the women's care product could cause breast cancer or not. So a clinical trial was conducted in California last year in which they used 36 women, and they were given a different kind of personal care product which were deprived of those endocrine disruptors. And they took the sample before and after. They did the urine and blood, and ultimately they concluded that indeed, uh, if they use personal care product which are deprived of certain endocrine disruptors, they will not activate the genes which are responsive for causing breast cancer. So my advice to the younger generation would be, it is important to read the label what you are buying. And it is important to stay with the brand which you are using, because with time we are moving into different kind of sales and all this marketing promotion, and we are not paying attention what is there in the fine print. So again, these are some of the questions which I would like to raise. And so one of the goal of the foundation is to keep promoting breast cancer awareness through scientific means, and we are only championing those risk factors, those things for which there is science to support it. Also, while we wait for all of these things to mature, it is equally important for us to start communicating the best science in the young breast cancer to the larger community. And with that in mind, the foundation also created the first such young breast cancer journal. We have editorial board from 44 different institutions in 14 different countries. And we are publishing papers in all areas of quantitative research, whether it's a population-based or it's a laboratory-based. So we invite all of you to think about this journal and support this journal. Try to bring your best work into this journal. So we have many global initiatives, and one of the global initiative is to promote the core issues of breast cancer into very comprehensive flyers, which we have in 13 different languages. Just going through this flyer itself will give you a lot of awareness, And now the recent data suggests, not from India, rather all around the world, there the level of awareness between the rural India or urban India, or rural versus urban in any city of the world, is almost the same. Younger people still tend to think that it is a disease of the older woman. So reading these flyers itself will provide you a lot of information. We also have a comic series, and each comic have a theme. Right now, this comic is in two different languages, but over time, we are like to translate into many other languages. Foundation is also trying to put together a documentary where we will be covering different countries and different culture based, what are the common issues and what are the unique issues. Foundation is also trying to highlight this issue in peer-reviewed journal through scientific meeting and organizing events. Most recently, we decided to create a youth council, and the reasoning for youth council is right here. As I mentioned, that those women who are likely to be diagnosed in 2040, their mean age in 2040 will be 33.7 years old. For India, it is 33.96. So that means all those girls who are likely to get breast cancer in 2040, they are only 17 or 18-year old right now. So we do have a larger window where we could start interfering with the process and try to educate our younger colleagues, our younger generations, what are the risks which could be modified. With that in mind, we decided to create youth chapters, and in the first phase, we are creating this youth chapter in medical schools or nursing schools or university campuses. And the primary focus of this chapter is to talk about breast cancer as a part of their everyday life in a campus life. So far, we have created 11 such chapters, and each chapter has a very structured view. There is a president, there is a vice president, and the website which we have a dedicated page for each chapter. These are some of the examples of chapters I listed here. And the reason we decided to focus on healthcare schools simply because these are the future healthcare provider, and they will also address the issue of diagnostic delay because of the healthcare provider. It is very common to hear the stories when a young woman will go to a doctor. Many times the doctor will dismiss the case, oh, it's because of this, it's because of that, you are too young to get a breast cancer, it cannot be. And they ignore the fact that the doubling time or the growth rate of younger breast cancer is 3 to 5 times faster than the older woman. So that means a diagnostic delay for 6 months in a younger woman is equal could be equal to diagnostic delay of 2 to 3 years in an older woman. So again, we decided to sensitize the issue and to the frontline champions of the healthcare. So the going forward, our global initiative will continue. Uh, Go to the community, talk about it, go to the educational centers, promote the journal, and try to see if we can get the best science in the field published in these publications, in this journal. Our goal for each youth chapter is to reach out to 250 girls in a year. So far, we have created 11 chapters, and we are working with a group of 37 nursing schools all around India. Our goal for this year is to create 50 chapters and 100 chapters within 3 years. And thus, we want to reach out to 25,000 young women within 3 years through this program. And we just had our first meeting in Lisbon, and where we invited a lot of leaders in the field, both from the medical fraternity as well as young breast cancer survival and advocate all around the world. Based on that, we have identified 3 close-ended research questions which have not been addressed, and we are just starting a moonshot program for that. We are also trying to bring new issues to empower at the educational institution with our material. And we just created this program, Hope for the Young Woman, Hope for YW. With that, I will stop it here and will be happy to take a question after the session is over or at any point.
Thank you so much, Dr. Rakesh ji. It was a really, I think, in many cases, eye-opener for many of us, where, you also touched upon several of the controllable risk factors. Of course, early menarche and all is uncontrollable. Family cancer history is uncontrollable. I mean, we can't control it, but many of the several risk factors you mentioned is very useful. We would like to take the questions at the end of the after the 3 speakers come in, given that, Dr. Samrakshini has to attend to a patient at 11 a.m. So thank you so much, Dr. Rakesh. Kindly stay on. Audience, please post your questions on the chat for Dr. Rakesh ji, and we'll pick it up right after the second speaker. So we are very happy to have Dr. Samrakshini, who, as I mentioned, is a breast cancer survivor, a wonderful, inspirational fighter. And she came in at very short notice. She's a fertility specialist in motherhood hospitals at this time. Dr. Samrakshini did her MBBS from NTR University of Health Sciences. After that, she did her DNB in OBG as residency program in Care Hospital, then DGO in Gandhi Medical College. And she was a senior resident in Care Hospitals. After that, she was a fertility specialist in Aishwarya Fertility Services in Hyderabad, and then consultant at Mannat Fertility Clinic. And today she's consultant fertility specialist in motherhood, fertility, and IVF in Bangalore. She is, conducts a lot of breast cancer awareness programs. And, she's many people hesitate to share their story. And here is a fighter who is willing to actively participate in cancer awareness programs and advocate the importance of early diagnosis in cancer. Over to you, ma'am. Would love to hear your story of how it was to get detected in early stage young women, young girl, and how and what are the things that were going on in your head? How did you face and address this issue? Thank you so much for agreeing to speak at this forum.
Good morning, everyone. I'm Dr. Samrakshini. At the outset, I would like to thank Dr. Geeta Manjunath and Dr. Rakesh for inviting me. Though it is a short notice, I could not say no because the things you are working on are really close to my heart. While Dr.
Great.
Geeta
Thank you.
is working on AI-based technology, which is diagnosing cancers early and easily, and Dr. Rakesh has been working in cancer research even before I was born. So I would like to thank you both for this kind of dedication towards cancer. Coming to my story. So anyway, Dr. Geeta has given a detailed introduction about me, so I'm not going into that. So I was diagnosed with breast cancer at the age of 29. But my first encounter with breast cancer happened 2 years prior to that as a caregiver. So, 2 years prior to my diagnosis, my elder sister was diagnosed with breast cancer. Till that time, we didn't know that we were at risk of breast cancer because there was no first degree relative of us who was diagnosed with any type of cancer. So, when she was diagnosed, we were shocked. We She had to undergo a series of tests, and she also underwent through a test called genetic test, wherein the genes which might be related to breast cancer have been tested, and she was tested positive for one of those genes. And then the oncologist has suggested me also to undergo the same test, and then wherein I also had the same gene. So after that, the oncologist asked me to undergo ultrasound scans and MRIs for breast every 6 months. So I was regularly doing my surveillance for almost 2 years, wherein they could not find anything for first 1.5 year. But at the end of 2 years, they found a very small tumor, which is not easy to be palpated by clinical methods. So there is a method called palpation, wherein you touch your breast and see if there is any tumor inside. That was not able. That was very small to be identified by that method. But then luckily I was aware of my risk. So that's why I was undergoing an MRI wherein they picked up a very tiny tumor, which was around 7 to 8 mm. And I was really lucky. At this point, I would also like to thank all the other researchers who have been working on all the type of cancers, because if not for them, we could not undergo our treatment properly. We don't know what to do if you get diagnosed with such thing. There have been a lot of researchers who have been working on this for decades together, which made things easier for us. And maybe we can also say that whatever life we are having, we should be thankful to them, because I was educated and I came to know that I am at risk of breast cancer. That is how I was undergoing the surveillance, and luckily I was diagnosed very early, which was stage 1 of breast cancer. So while I was diagnosed, I just completed my post graduation and I was waiting to start my career as a gynec consultant. So I had to take a break from my career. I had to undergo the treatment, even though the tumor was very small. As Dr. Rakesh rightly said, the breast tumors in young women are rapidly growing compared to the tumors in elder women. So there's a score called a KI67. The score is usually around 20 to 30% for elder women, whereas for people like me who are diagnosed at an early age, for me, the score was beyond 90, which means it was very rapidly growing. We can also see this in the last scan. I had no tumor, and within a time of 6 months, I have developed a tumor. Though it is a smaller size, but it was really rapidly growing. Because of which I had to undergo all the treatments related to cancer, which you can say chemotherapy, radiation, and surgery as well. So I had to first I underwent surgery, in which they removed the tumor, and then they also checked my underarms, which is called axilla, to see if there is any spread. Luckily, there was no spread. So I have decided to remove that tumor. Along with that, I had to undergo few cycles of chemotherapy, which was 4 cycles. And after that, I also underwent through the process of radiation for a period of 25 cycles. So after that, I was declared cancer free. And as the discussion, as the Dr. Rakesh has already discussed, the chances with the young cancer survivors, struggles young cancer survivor face are very different compared to elder person who is undergoing cancer phases. Coming to my case, I was 29 at diagnosis. I was not married, so I didn't know whether I would like to have children in future or not. So, and cancer treatment can also put you at risk of menopause. So, I had to undergo a procedure called fertility preservation, which was available for me because I was early cancer diagnosed, and I had that amount of time to freeze my oocytes. If you're diagnosed early, you might not have that amount of time to give for yourself to freeze your oocytes. And then we are lucky to have this kind of technology so that you freeze your oocytes before going for treatment, and then you can use it later on, or you can at least have a backup in case if you want to have children later on. So that is one kind of challenge young cancer survivors face. And coming to the other challenges like career, because I was just at the point of best time where I was supposed to start as a consultant, and then I had to take a break of almost 8 to 9 months, wherein I felt like I was, left behind compared to my peers. But then luckily my family and my hospital where I was working, they were all supportive. But then it's a big challenge for someone who has studied for almost 10 years, and then they could not start their career immediately. So that is one issue. Then I underwent all the treatments. I took a break for almost 2 to 3 months to recover physically. During that time, I used to try to read some storybooks, motivational books. I used to continue my meditation, which I have started before as well. And after recovering a little bit, I started doing regular yoga and gymming, which has helped me to regain my strength. And after I've completely recovered, I again started working as a fertility consultant. Now it's been almost 4 years of my cancer treatment, and I am doing really well. All thanks to the researchers and doctors and my family, which has always been supportive in all the situations. Yeah. So yeah, that's it from my side. If you have any doubts, we can discuss.
No, thank you so much for sharing. It's really a major inspiration for us. And the way you talked about the genetic test, proactively taking the genetic test, proactively doing the, preservation of the eggs and so on. I think it's something that educated women like all of us should, really promote and talk about, and then learn from your experience as well. And hats off to you, ma'am. I have no words, but it's so nice. And you've also chosen the path of gynecology, where you are able to sort of advise the same to your patients as well. So thank you so much. And given that you need to leave at 11, if there are any questions from the audience for Dr. Samrakshini, we will take that first and then move on to Dr. Rakesh, sir. Anyone from the audience has any questions? So, ma'am, while people think about the questions, what are the 3 things that you would advise every girl to do, right? Of course, we talk about clinical examination based on your experience, right? Every girl. Second, what are the 3 things that a person who has family cancer history needs to do, and at what age?
So anyone who has a cancer history or who is not even having a cancer history has to be aware of what is going on in their body. So if there is anything suspicious, they have to reach out to the doctor, because before my sister was diagnosed, we never thought we had a cancer history. Now that she is diagnosed and then genetic testing is done, it is a genetic cancer. But then you might be having a gene or some other history, but it might not have been shown up in your family yet, because my father doesn't have sisters, so this gene was not shown up in that generation. So there is always a possibility you might be at risk of cancer, but you might not know it. So you should be aware of what is happening with your body. So coming to breast cancer, if you have any tumor, you have to get it checked with a doctor. And if it is growing in size, or if there is any abnormality you can see, like nipple discharge or puckering or pain, anything, you have to see a doctor. So if you are really having a family history, you have to start your surveillance from the age of 25 years only. You need not wait till the general saying that you have to do mammograms after 40 years. It's not the same, because nowadays cancers are coming very early compared to what it was few years ago. Every day, at least every week, I hear from a stranger or from my own colleagues or my own juniors or seniors saying that one of my family member is diagnosed with breast cancer or some other cancer. So it is pretty common. So that's why you should never underestimate the incidence of cancer these days. So any abnormality in your body, you have to get it checked and confirm that it is not cancerous. And even if it is cancerous, obviously you have to go for the treatment. And then apart from this, a healthy lifestyle obviously will help you. It will not make you 100% cancer proof, because I also had a healthy lifestyle before getting cancer. But then obviously it will help you to recover faster from your treatment. It will also help you to maintain a positive attitude throughout whatever you are going through. That is one thing I would like to say. And apart from that, I would like to also emphasize on insurance for everyone, because medical insurance is not so common in our country. But with the type of medical ailments we get these days, if you're not having an insurance, you will be financially drained within few days. If you get a situation like cancer, you can't stand any for throughout the treatment. It's not that easy. So I would like to suggest all the youngsters to have some kind of medical insurance, which will be really, really helpful. So these are the main three important things. Even though the third one is not related to health, but then
I think
it's
it's
really important.
Yeah, very, very important points. Thank you so much, ma'am. And I would also further the points you mentioned, self-press examination, as well as, with Thermalytix, we've been able to detect even a 17-year-old with cancer, unfortunately, like Dr. Rakesh sir was saying, much, much earlier as well. Thank you very much. I'll let you go and request Rakesh sir to come in for the Q&A. Thank you so much, Dr. Samrakshini. It's really
Thank you
a
so
great
much, Dr.
inspiration
Geeta.
for all of us to look up to how we fight and go back to our normal life. And so breast cancer is curable. You can fight it. No need to be scared about it, but we have to detect early. Thank you so much, Dr. Samrakshini, ma'am, for coming.
Right.
Thank you.
Thank you so much, Dr. Geeta, and thank you, Dr. Rakesh, for inviting me.
Thank you for coming. Thank you.
Thank you.
Thank you.
Thank you. Thank you,
So,
Dr. Rakesh, for the wonderful talk. So there is already a question for you, sir.
So in fact, before I go to the question, I would
Sure,
just like to add something what we just heard.
sure,
So,
sir.
and because I lost my slide, but I will definitely share later on. So the idea here is genetic test is very important. On the Foundation YouTube website, there is a story from breast cancer survivor from Australia. Her name is Crystal Barter. She was the first woman in Australia who underwent mastectomy for the first time. And before her, she lost 22 women in the same family over the last 100 years. 22 women, you know. So it was running in the genetic family. She was lucky to be tested. There was no test available. She was the first one to be tested. And her fame really goes to the fact that Angela Jolie followed
Yeah,
her
yeah,
all the way, and they became friends. And again, they are the
okay.
one who are now promoting genetics test. So again, power of awareness is very, very important. Now, as opposed to 22 women she lost, her outcome is very different than her mother, than her aunt, because she was aware of it. She could take
Yeah.
all the precautions that needed to be taken. That's one thing. Another thing I like to just mention, power of awareness. You know, so there is a story of Nicole. Nicole is a nurse in Sloan Kettering Cancer Center, and she has shared her story on the foundation website. She detected her own tumor, which was 4 millimeter, cannot be picked up by the mammogram by itself, and was missed all these years. But she, being a nurse, she was aware of it. So she could really save her life. This is the value of awareness. This is the power of awareness. So with that, I would just like to go back to the questions you were asking. So I think it's very, very important. Every young girl must know the risk which she is exposed to, with or without genetic factor, because in today's time, it is possible every woman to know the risk factor, and they must not believe it's a disease of the older woman. And
Yeah.
the big thing is they must pay, because women's health is important, but the breast health is the cornerstone of the woman's health. And they must do certain things just like they do it for everything else in their life, every day.
Exactly. Exactly. Yeah, absolutely, sir. Thank you so much for that additional examples. I was thinking maybe Angelina Jolie was the main person and the first person, but I think it was interesting that you brought in additional information about some of the other survivors. So there's a question from Shiva Kumar. It says, thank you so much for your talk. It was insightful. He wants to ask, what are the latest advancements in breast cancer research and how do they impact treatment options? Would you like to briefly share some of the?
So right now, most of the, I mean, so two things here. What we practice on the young women, by and large, is largely driven from the clinical trial, which largely were conducted on the older women. And
Yes.
the ratio of younger women was very, very small. But now it is mandated in US and in Europe. At least 10% of the population in any clinical trial need to be younger women. So the data particularly is not designed for the younger woman. So then the recent data suggests that many time. So I think one of the thing I like to make is that the natural history of breast cancer in younger women is different from older women. This is the direction we are learning. The profile of the immune system is very different. How the younger woman tissue will react in terms of cytokines or the immune response are very, very different. We are learning now. But going back to the question, but we have not reached to the stage where this data could have any impact on the treatment. Because when it comes to the treatment, it has to undergo a long process. So I would still say breast cancer is one of those cancer. If it's detected early, it is curable. And the early detection starts with your timely awareness. So it
Yeah.
really
Yeah.
comes down to the fact, yeah, once you have the disease, uh, many organizations can provide you the roadmap, can you get connected, but again, we cannot reverse the process. Idea is, can we reverse the process? Yes, it's possible only at an early stage. So I would say all the cancer advances at this stage are not primed to be implemented in the treatment yet. So I'm very sorry to say that we have not made any progress in a way in terms of treatment. We have made a lot of progress in terms of awareness, but we have also not made progress in treatment or screening methodology, which could be applied to the masses, because we would like to reach to a situation where a girl of 18-year-old, 19-year-old will know that these are the probabilities he might get a cancer, based on her lifestyle. There is a score which comes out, a polygenic score, or whatever you want to call it, but we are not there yet.
Yeah.
And
Yeah.
and in
So,
either case, we need more tools, and I think what Narama is doing is one of the tool, and there are much more devices on the market now based on microwave and many other technology, but all of these are in the developmental stage. None of these things are usable for the patient at this time.
yes, sir. Thank you so much. And probably that's a segue to that third segment of the panel discussion. We have more questions for you sir. Please,
I will be
I
here. I
know.
will be here.
Yes, yes. We have more questions for you. So the third segment is exactly what Dr. Rakesh sir mentioned. That is what I don't know whether we're able to see it. My laptop is suddenly, yeah. So that is, are there any tests that can easily detect it a population level screening, even for people with, young women with early breast cancer? And some of you know about Thermalytix, but just to sort of give the further idea about how devastating breast cancer in young women could be, while this is focused on the US in terms of 80% of women aged under 45 years. Even in the US, where there is a regular screening for women above 40 to do screening with mammography, they find their cancer. 80% of them find their cancer and the abnormality on their own with clinical breast examination, with which earlier was referred to as well. And African American women have 2 times more incidences compared to the others, and 3 times more mortality rates compared to the Caucasian women. And of course, there's traumatic issues post-surgery, right? It's also body image issues, loss of breast and loss of hair, and also premature menopause, hormonal treatments, fertility issues, which was touched upon, how we handle those as well. And of course, psychological issues with yoga, etc., that Dr. Sribar, mentioned. So we actually, can fight many of this, that Dr. Samrakshini mentioned, etc. So there is a way of doing it. So at Niramai, as you know, we've developed this new method of detecting breast cancer, which is Thermalytix, which is just measuring the temperature variations on the chest. And with the first Journal of Young Women Breast Cancer started by Dr. Rakesh's foundation, and as he mentioned, only clinically effective, quantitatively proven techniques are published in the journal. And we are happy to share that, Thermalytix, the evaluation of Thermalytix in young women, right, as a post-hoc study, was actually accepted and published in the journal. And I invite our principal scientist, Dr. Sivateja, who is also Forbes 30 under 30, to just give a quick view, like 5 to 10 minutes view about this work of how, it is a promising technique for detecting breast cancer in young women as per the journal paper, and also present the results that were shared there. Shiva, if you're there, would you like to share the slides yourself? Or?
Yeah, Geeta. Can you hear me?
Yeah. Yes. And then we would go back to Dr. Rakesh sir. I want to hear more questions, see more questions on the chat. Yes, Dr. Shiva, please go ahead. Yeah.
Right. Thanks, Geeta. Hi, everyone. So today I'll be talking about the performance of Niramai's Thermalytix on younger population. So we all have heard the severity of breast cancer from previous speakers in younger women population. So just to summarize the incidences and some facts about breast cancer. So what you're seeing in this slide, it tells that among all the cancers that are there, breast cancer has the highest incidences for women above 25 years. And it's also the leading cause of cancer deaths, with 1 in 4 cancer deaths almost contributing to 25% of the cancer-related deaths to the breast cancer. Specific to Indian population, 1 in 28 Indian women may encounter breast cancer during their lifetime. And unfortunately, we are losing 1 out of 2 women diagnosed with breast cancer to this disease. And 50% of all breast cancer cases which we're seeing today are in women less than 50 years. And as Dr. Rakesh has pointed out, these cancers are more aggressive with poor survival and high mortality rates. Early detection is key to the survival, as the previous speakers have pointed out that if you can detect cancers in their early stages, it is completely curable with very high survival rates as close as 100%. But in India, we are still detecting cancers in their initial stage with the hand examination, which has only sensitivity less than 50%. So that's where Niramai, we developed this technology called Thermalytix, which is a novel fusion of artificial intelligence and thermal sensing. What happens when there's a cancer is that cancer is nothing but uncontrolled cellular growth. So because of which it requires more resources, which causes neoangiogenesis. And all of this increased metabolic activity increases the heat production, which transfers to the surface using tissue conduction and venous convection. Currently, we have thermal cameras which can measure minute temperature variations up to 0.05 degrees centigrade, which a human might not be able to measure or visualize. But with the help of thermal cameras, we can generate a picture which shows the thermal gradient between different temperature values. What Niramai Thermalytix software does is it takes this thermal image and generates a contrast-enhanced image along with automated thermal radiomic parameters, completely automated fashion, so that it assists the radiologist in detect cancers easily. So in short, instead of looking for lumps that we're doing in India or in many of the countries for early detection, we are looking for cancerous activities. So on the right-hand side, you can see how Thermalytix test is conducted. So technician is completely outside. A woman walks in, and there is a thermal camera, and there is a cooling setup. So the woman, so I'll walk over what is the screening process. But as you can see here, the camera is portable. We can carry in a backpack. And the thermal cameras, which we all might have seen during COVID, it just measures the long-wave infrared radiation that's emitted naturally from a body. So it is completely safe. There is no radiation. And since the technician is outside and the woman the screening is done completely inside a cabin kind of setup, it is completely privacy aware as well. And one of the most important thing is the cost of the device. So the cost of this thermal camera is close to 1/10 or 1/28 lower than the standard or traditional imaging techniques, which makes it more affordable for countries like India. So this slide summarizes the overall patient experience. So when a patient walks in, the technician explains how the imaging is conducted and what are the advantages with Thermalytix technology. We cool the subject for 10 to 12 minutes so that the patient attains thermal equilibrium with the surroundings. And we capture 5 thermal images so that we can get the full 360-degree view of the breast temperature profile. And once we get this breast temperature profile, we upload this into Thermalytix software, and a report is automatically generated and sent to doctor for verification. And once doctor verifies and certifies, it is available for the technician to download and hand over it to the patient. So in order to understand how Thermalytix is performing on young women, we have conducted a meta-analysis where we looked at all the publications in the PubMed. There are 6 publications that talks about Thermalytix performance on different populations. And out of that, there are 3 unique study data, which gave us close to 1187 population. And in these 1187 population, there are 463 younger women population uh, who went with Thermalytix as well as the standard of care. So when we say standard of care, it is mammography, ultrasound, and biopsy in case of imaging positive. So each of these 463 women underwent to standard of care and in parallel Thermalytix. Both the results are blinded to each other. And at the end of the study, when we compared the performance of Thermalytix on this younger women cohort, we saw a sensitivity of 90.7% and a specificity of 82.1%. But because we are pooling the data from multiple studies, so we have obtained the pooled performance as well using random effects, which resulted in a high sensitivity of 96% and a specificity of 82.3%. This shows that Thermalytix is very effective and a potential tool in detecting breast cancers for younger women. So the sensitivity of 96% means that we are detecting majority of the cancers. If there are 100 cancers, we are able to detect 96 of them. This is very high when compared to the other published studies that show the performance of standard imaging modalities on younger population.
Thank you very much, Shiva, for sharing an overview of and abstract of the publication in breast cancer.
Yeah, so there was a question from Lakshmi that is there any genetic test done in India? Are there any specific genes which are particular to Indian population? Are we aware of it? Yes. So two issues here. Yes, genetic testing is available in India, and most of the government hospital will refer to some genetic testing which are very common, but they will not do a comprehensive genetic testing. One of the pitfall here is if a patient try to do genetic testing without taking their doctor in confidence, chances are even if you have a test result with you, doctor is not going to look at your report or change their treatment at all. So it is good to keep your doctor in the loop, because ultimately, even if you get the test done, but if the medical professional is not willing to look into the implication of these tests and make a modification in the treatment, it's of no use. So it is very, very important. Second thing, are there genes which are specific to Indians? Yes, there are genes, but they are not at a stage where they could be applied to the masses. They are not part of a diagnostic test. Most of this work is still at a research and development stage. But I would definitely like to say that there may be genes, there are genes in fact, but those genes are not going to give you much information in the end, because a cancer cell is a cancer cell in the end. And there are thousands of genes. Even if a handful of genes are different, and if they are not critical genes, it's not going to change the biology of the disease. Yeah, they can help you to differentiate, but they are not changing the biology of the disease. So by and large, we are not at a stage where we could go back and test in a diagnostic setting Indian specific genes for breast cancer. We are not there yet. All the work is at research and development stage, and we are not even close to that we could be coming out a test, and there's no need to have the test either.
Yeah, thank you. So sorry, I something happened to my audio in my laptop, but thank you for that comment. But some of the startups like Map My Genome, MedGenome, these are providing the genetic tests in India with reasonable pricing, and so I guess those with family cancer history can still avail that in India. So one of the questions I had for you, Dr. Rakesh sir, is about the personal care products that you mentioned.
Yeah.
So you mentioned that we have to look at the label and maybe the composition of what they're using. So are there certain guidelines of what they have to look for? Is let's say breast cancer, Young Women Breast Cancer Foundation going to give some guidance on what are the sort of safe category products, etc.? What are your thoughts in that direction, sir?
Yeah. So yeah, in fact, we do not have a guidelines per se because in US, so this has been around for almost, there are a lot of epidemiological studies connecting use of personal care product in the younger generation with cancer at large. This has been around, but there is no data to support it experimentally. So the first clinical trial was done only last year with 36 women over a period of 28 days, and results are day or night difference. Yes, there is a good correlation. So this is an area which is which could be challenging here to conduct studies because of the um, large business houses, how they may be. So again, there is no guidelines in terms of personal care product, but I would like to make a point that phthalates and endocrine disruptors. Now, many of these molecules have many different names. They do not have one names, they may have a generic name. So for a common man to go and read all this is a challenging issue. Okay. So based on the clinical trial, I'll be happy to summarize the list of the product because the PI of that study is in touch with me,
Okay, I think
PI
that would be
of that study is in touch with me. And because see what's happening now, many time a personal care product will come on sale, we will just buy it without worrying about it, and we'll be changing the brand every 2 months, every 3 months, and that's not right actually, So this is what was the purpose of this study. They have personal care product, everything. So like I mentioned, lot of women are getting early menarche. So this
Yeah.
study from NIH has used a screening technology where they found that certain fragrance, certain soaps and other molecules, there is a class of molecule called nitromusk group of compound. And if they give the nitromusk to the experimental model system, hypothalamus get activated. In those experimental model systems, they have shown that the maturation of progesterone and estrogen pathway is preponed, So there is because ultimately the puberty has to be linked, the menarche has to be linked with the hypothalamus and the controlling system. So what are those factors? Environmental factor, which we can inhale from the nose and it goes into the brain right away and activate the hypothalamus. And if such signals are given over a long period of time, obviously your reproductive axis will be affected because of the reproductive hormone LH and everything which is controlled by the brain, So there is a very good science behind this paper, what they are going to come out. So this was a great study, I would say. So this is also part of the personal care product in the end.
Okay. Thank you so much.
So two things. One is personal care product, which I suspect because I talk to a lot of breast cancer survival. So I have a breast cancer group in New York City. I have a survival, and she has around 30 plus groups in their own group because all of these girls became friends during the treatment. So what my contact mentioned to me, her name is Teresa. She is on the foundation awareness team. What was common between all of these girls was they were all taking contraception at a very early stage. That was the what you call link between all of them, And another thing which is suspected now is processed food, and the ultra processed food is very important. And there is a video on the YouTube from the foundation where the inventor of this study has talked about how the food could create changes in the memory duct, which will be permanent in nature now. So usually memory duct will go through regression during in a monthly cycle, but in these rats, in these animals, they were fed a different kind of diet with the high fat and processed and non-processed from early stage to puberty to adulthood. So the changes created by the high processed food were irreversible even after evolution.
Okay. I think this is a rare kind of a talk, I would say, where you've touched upon the statistics, you've touched upon the why aspect, and also some preventive methods that people can adopt to reduce their risk to breast cancer. And, Dr. Shiva also talked about thermalytics, where we can do specific tests, on a regular basis, like thermal. And as I said, we've detected even 4 mm cancer. So with all this, I think we are all getting ready to fight for breast cancer. One last thing that is remaining is how do we spread awareness in women as young as school kids and colleges? And for that, sir, it's very nice you're starting Youth Council for Breast Health. So one last question. What is the call for action? You have a wonderful audience here, and some of them are going to watch the video later in the day and later in the month. So for them, what is your call for action if they want to participate in this awareness spreading initiative that Young Women Breast Cancer Foundation is starting, and your goal of starting at least 250 such councils this year? So how does one collaborate with you? Of course, Nirama is already a partner and collaborator for YWBC. So what BCYW? Sorry. So what is your call for action for youth to start Youth Council for Breast Health in their own colleges and schools, for example?
So in fact, I mentioned to Dr. Geeta, I was preparing this talk and I did not save my talk. There were 2 slides referring to this question. So, Dr. Geeta, it is very, very important that, see, we know that cancer is increasing, but many of the public awareness material has very little talk about how to prevent it. They only talk about risk factors. Oh, this is a See, how can now we are learning about everyday chemical? There are 12,000 everyday chemical. We still have to live our life, There are 400 compounds which have been shown to promote cancer in mice, There are thousands of compounds which could cause cancer by implication. So because every day in the newspaper or in PubMed, you can keep looking, there will be new risk factor every single day, maybe more than one, So that's not the way to live our life either, So there are risk factors which have been proven with time, and they are science-based, and they are not hundreds, they are less than 10, in fact, So okay. They are less than 10. So I would say our approach is twofold. We will continue to go into the community and talk about awareness, but our largely focus will be on the youth chapters or local youth groups, simply because going to the community, there is no way to follow with time. There is no way to see how the progress we are making, and each time the population has been changing, so ultimately it's resource intensive. Either we have to go there or they have to come. In either case, it's a logistic challenge, and there's no way to follow up those particular cases. So the idea here is that if those women who are going to get breast cancer in 2040, they're 17 or 18-year-old now, and about about 50% of the cases are between 20 to 34-year-old. Okay. Half of the problem in breast cancer is, breast cancer is universally detected at a very advanced stage as opposed to the older women. And half of the problem is because of the medical profession. They will universally dismiss the doubts and the concern of a young woman. So the idea is to sensitize them to not to do that. But at the same time, it is our health. It is the young girl's responsibility to take care of her health. If her eyesight is not right, she will go and change the glasses. She will do every single thing to do it right. If her makeup is not looking right, she will go back and fix it. It is her body. She should be the one looking after her body. So idea here is educating the right class. So our focus in university and colleges, we are working directly with NGOs, or we are working directly with the prospective chapter holders in a way. It could be a college principal, it could be a college professor, it could be a survival. But idea here is it should be at an institution which is educational in nature, And we are not going to high school because of the age and legal issues. Has to be college campus, medical. So right now our focus is medical colleges and the nursing schools largely. On the website of the Youth Council, there is a form how to create a chapter. It's very simple to do. Right now we have chapter create. We have girls working in Queen's Medical College in Toronto, in many other countries. So we are creating about 10 to 12 more chapters in different countries right now in next few weeks, in fact. And our goal is to reach 50 chapter this year, and 100 chapter within 3 years. And I think the way it is going, we will be able to do that because so the creating, we have a standard protocol which we could follow. So idea of Dr. Geeta, these chapters are locally created in your hometown, in the college you come from, in your circle you come from, and I will provide you every single support you need in terms of all the logistic, what needs to be done, how to do the record keeping. Because by the end of the day, if we want to say we have reached out to 25,000 young women through 100 chapters, we should have a record which could be audited in the end, So
Yeah.
all the membership is done online through the form. All the chapters are created online now, So it's a very standard protocol and it's not complicated. Most important thing is in creating this chapter, it does not require any resources from anybody. It only requires your will to do something.
Perfect. I think that's a great way to end this session. Those of you who want to know more about this foundation itself, please go to breastcancerinyoungwomen.org. It's a very simple thing to remember, breastcancerinyoungwomen.org. That is what Dr. Rakesh sir has started. And those of you who want to learn about the test that Niramai is providing, please go to niramai.com, where you will be able to book your tests, either in the nearest 280 locations in India provide Niramai test, or you can even order the test home by booking an appointment on home screening. So with this, let us take the oath that today we will spread the awareness about breast cancer in young women, at least to 5 more people in your circle, would be friends or family, and let's take an oath to volunteer to create this awareness, together fight this disease, which is completely curable, completely healthy, as we saw some of the stories of the survivors earlier. Thank you very much, Dr. Rakesh ji, for staying up so late. I know it's close to midnight for you, and it's a real pleasure to have you on this particular webinar conducted by Niramai. And you continue to look to collaborate with you to try and see how we can contribute and volunteer to foundation efforts that you're doing, as well as together fight this disease that is completely fightable. Thank you so much, Dr. Rakesh, and thank you very much, audience, for being and staying till the end of the session. Any questions, please shoot out to Dr. Rakesh sir, or log on to breastcancerinyoungwomen.org to share your thoughts. Thank you, everyone. Bye for now.
Thank you, Dr. Geeta. Thank you, everybody. Dr. Geeta, we need to create few chapters there.